Mm. Hello, everyone. Yeah, I see lots of people connecting to audio. Okay. So I believe we can begin. Welcome everyone to our webinar. My name is Surah Abdulrahim. I'm the marketing manager at THETA. Our webinar today will be on digital transformation. So as the name suggests, it's going to be related to IVF clinics, and we're going to be discussing how the transition from paper to digital would be. I'm going to be the moderator for this meeting, and we're going to start by welcoming you all. So hello, everyone. You've probably received emails from me. This is the face behind the emails. Our agenda today will be the opening, which we are in right now, and then we're going to have a brief introduction about data and discussing digital technologies in IVF clinics overall. And then we're going to dive deeper into from paper to digital. After that, we're going to have a live Q&A session, and then we're going to close off the webinar. It's going to take around 90 minutes, and we hope that you find it knowledgeable. During the meeting, we want to be hearing from you. So we want engagement from everyone here. And we're going to be doing that using something called Slido. So I will ask you to take out your mobile devices, scan this QR code, or log into slido.com and write the number that's on the screen. So 2401224. So once you log into Slido, you will have a prompt for this question. And the question is going to be as follows. Do you use an EMR system for your patients in your clinics? So an EMR, okay. An EMR is an electronic medical record system, or do you use paper files? So paper files here does not necessarily mean only papers. It can be Excel sheets or databases that are locally on your devices. So we have 4 people voting, paper files, EMR. Okay. We're gonna wait 1 minute to assess like how many people use paper, how many use EMR systems. Still mainly paper files. Okay. If someone's facing an issue, you can directly message me and I can help you with that. We have 6 people voted, paper files, EMR. Okay, and we have one in the chat. It says paper. Okay, so as we can all see, paper is the majority here. People use paper files to document patient data within their IVF clinics. And the way Slido was used, we're going to be using it throughout the webinar. We're going to be asking some things. And then the live Q&A at the end would be using Slido. So now that we're all set with your devices on you, let's begin. The first space will be delivered by Abdurrahman Kayali. So, Abdurrahman, I'm giving the mic over to you. Mhm. One
Okay,
second.
thank you, Sarah. Okay, thank you, Sarah. Good evening, everyone. I would like to thank all the attendants for sparing the time to attend this our first webinar actually this year, which we plan to have it as a regular webinar to cover several topics for different interest groups as part of our responsibilities toward our clients. My name is Abdurrahman Al-Kayali. I'm the founder and CEO of THETA Consultancy and Business Development. For those who don't know THETA, THETA was founded in 2019 with a mission of assisting our clients to overcome challenges and uh, uh, explore opportunities through offering two kinds of services, digital transformation, which is part of what we are going to do today, and business consultancy. And today we are proud to say that we have helped a lot of clients across various industries transform their business, realize growth, build competitive advantage and strategy. So, yeah, after giving this intro about THETA, let's start by setting some bases to what we are going to cover in this session. And let's define first what's digital technologies. So digital technologies are electronic tools, systems, devices, and resources that generate, store, or process data. So it's by the end of the day, it's all about data and what can be generated from different tools, devices, and systems to be stored and processed. Okay, so what do we benefit from having digital technologies? So digital technologies can help to streamline process, increase efficiency, improve productivity, and save money, of course, by the end of the day. I'm sure in the IVF practice you have a lot of technologies you are using, and uh, it's better for us to go in some of those technologies as an example, just to correlate things to the IVF practice in general. So the first technology I'm going to talk about is the AI, which is one of the most developing technologies recently. All of us noticed in the last 7 years, in the last years, I mean, the evolution of utilizing the AI in our daily life. The IVF as a practice is, of course, is not an exception from that. And accordingly, there was some available technologies that can assist the clinics and the patients to have better results in their cycles. Another digital technology which is utilized in the IVF practice is the electronic witnessing. And even if the human error in the IVF practice is very rare, the electronic witnessing technologies helps to further decrease the human error and reduce the patient concerns by reducing the paperwork and manual identification, of course, by the practitioners. And it will generate fair amount of data which need to be utilized during the cycle and after the cycle. Another digital technology is the time lapse. And even with the debate about the time lapse, about the benefit of monitoring the development of the embryos during the culture by using the time lapse technology, We cannot ignore the fact that time-lapse became one of the tools utilized in the IVF labs, and it's generating big amount of data. The fourth technology is of course the imaging and the image capturing, which is around since long time, like ultrasound machines, like CASA system, like the microscopes, and so on. But the development in these technologies is going very fast as well, and it's also important source of data for the IVF practice in general. So another technology is it's more related to the patient. So it's the mobile app, which is used by the patient. So we know that communication and patient engagement is one of the challenges facing the IVF practitioners. And patient mobile application is one of the tools to overcome the communication challenge, improve the workflow, and as well the documentation management in general. Okay, so all the mentioned examples of technologies and more, like labs, general labs, like microscopes, as we said, pharmacy, and so on, are considered as a big data points, which is generating data for each patient. And accordingly, an electronic medical record can take centric rule to gather the patient data from clinical, lab, and also administrative work. And it will facilitate better access to the data at any time. And also it can generate better reports and statistics, which can monitor the performance of the practitioners, improve the operation, and assist in making informed decisions. So all of those technologies and tools are part of the digital transformation journey of any clinic. But why clinics are not taking the decision to transform? So in 2020, and according to Boston Consulting Group, research shows that more than 80% of companies plan to accelerate their company's digital transformation. And why is that? Because successful digital transformation drive performance and drive competitive advantage as well. So again, engagement is very important in our webinar. So yeah, we would like again to take your opinion about what concern you you have on going digital. So if you can scan the QR code and vote about the concerns that you have of going digital. So yeah, you can scan the QR code, or you can go to slido.com and put the number to access the platform. Okay, staff acceptance, fear of change, none of the above, staff training. Okay. Mm-hmm. Let's wait for one more minute. Okay, so okay, so we have more coming. So based on what we can see here, the majority is saying that, or most are saying that staff training is of course one of the concerns they have. to go digital. And yeah, surprisingly, this is or not surprisingly, that's the right based on the statistics, based on the reports. So Gartner in their recent reports in healthcare, trends in healthcare, says that staff acceptance and training is the #1 challenge faced when planning to invest in a new software. So, yeah, to talk more about the challenges and the opportunities around digital transformation, within the IVF clinics, I would like to introduce Slim Jouini from our partner, MedITEX. Of course, Slim is a consultant. He is leading the international support team of MedITEX, and he did a lot of successful transformation projects within the IVF practice worldwide. So Slim, the mic is yours, and yeah, thank you very much for listening to me.
Thank you, Abdul, for the presentation. Thank you, Sora. Hello, everyone. Thank you for attending this webinar. So, as Abdul Rahman just said, my name is Slim Jouini, and I'm an EMR consultant, which is MedITEX. Let me just double check if I have control. Yeah. So, in this webinar, we're going to basically talk about the current challenges that clinics are facing based on my experience of over 8 years supporting and working on the system. So I basically had around 40 implementation, or I would say transitioning from paper to paperless for clinic, including 15 clinic in the GCC and ME regions. Of course, I have also provided and attended 30 trainings, whether on-site and online. So as previously mentioned, throughout this webinar, we're going to talk about the current challenges that clinics are facing with paper-based records. We're going to talk about the transitioning, how it's going to be done, and in the end, we will head towards the impacts that these changes or this transition would have on clinics and their operations. So similar to what we did with Sora and Abdul Rahman, you can scan the QR code if you haven't already done it. And it would be interesting to know for the clinics or for the practices or hospitals that are whether using an EMR already or they're just using paper records, what do they exactly expect from an EMR? So we'll give 1 minute, and then we'll see the results together. So I have 2 people, centralized data, one solution. All right. So I see that centralized data is basically one of the first expectations, an all-in-one solution, of course, the compatibility with lab devices, and the instant reporting. Yeah, we can give 20 seconds more, and then yeah, we can move forward. So I see that centralized data is actually the first expectation, and the all-in-one solution is coming back again. So let's see how to.
Slide is,
All right, I see that we have 9 people that voted, and I see that the first expectation from an EMR is for it to be an all-in-one solution and to have data centralized. Compatibility with lab devices and instant reporting are also important. So I will move to my next slide, and here I can talk to you about the current challenges and difficulties that clinics are currently facing based on my experience, including demos, seminars, issue meetings, hospital face-to-face meetings, and so on. And I noticed, and we talked about a lot of challenges due to the paper-based records keeping. So one of the first, I would say, challenges or issues is the time and resource consuming. As we know, writing everything to paper can be really time consuming. I think the biggest concern here is the data accessibility and storage complexity, because in the end, you will end up with thousands and thousands of paperwork for patients from labs and so on. The storage is really getting a little bit hard for clinics, and also the data accessibility is a little bit tricky, as yeah, this is also time consuming. We also noticed a lot of communication issues, whether with the patients or internal communication issues, or even with the labs. Talking about patients, for example, sending them their prescriptions, their results. The same applies to the labs, and we notice there's a lot of I would say latency in sending the lab orders, in receiving the results in order to provide them to the patients. Of course, if we're working on paper, the potential for errors is higher, as yeah, it's not really being checked by the system or by some workflows in the background, and it really counts on the staff members themselves to double check all the records for the patient, to make sure that they are documenting everything properly, and the processing time for patients. As I mentioned in the communication issues, we noticed that there are like long processing times for patient results, for example, or patient appointments and so on, as it is hard for clinics to deal with these lab results, lab orders, or appointments manually, which is again time and resource consuming. So based on these challenges and the issues that clinics are facing, why would we go paperless? I mean, if it's easier for a clinic to use paper, if a clinic got used to it and they have been using paper for a long time, the question here is, okay, but why would we change it? Why would we go paperless? Of course, this would increase the efficiency, and it will save a lot of time for the staff members, in addition to the patients themselves. One of the most important, I would say, features, or one of the most important reasons for clinics to go paperless, is the centralized and easy information access. So basically, you would have a system where everything is documented for your patient from day one, when they come to the hospital, the clinic, or the practice, until they get their results, until they start their cycles, and so on. And of course, all these details would be centralized and easy to access. Another important thing is the remote access in mobility. We know what happened after COVID, and people are prone to work from home, to work remotely, and so on. But with paper, there is no chance for staff members or for labs to go through patient data, and that's why going paperless, basically having a digital solution, would allow staff members, would allow labs, and even patients to access their data from any place. The workflows are also customizable when going paperless, so you basically don't have to stuck to the workflows that you have. As we know, digitization would offer this flexibility when it comes to workflows, and we also understand that these workflows can be different from one lab to another, from one department to another, and so on. And finally, the accurate reporting and analytics. Since everything will be digital, there is an accurate reporting. The conclusions and so on would be data driven. Most of the questions that I faced, and as I previously mentioned, in these meetings that I had, in these seminars, how to go paperless, I totally understand, and we totally understand that for clinics and for staff members that get used to a certain workflow, that get used to working on paper, it is a huge mountain to climb. But of course, this is, let's say, a one-time transition. but it will be beneficial on the long term for the clinics, for the hospital, and for the patients. So we are here offering a digital solution, and of course we'll be guiding the clinics and we'll be guiding the hospitals from the first contact until everything is set up. Of course, each clinic would have a different workflow, so these workflows should be analyzed in order to understand what are the actual needs, what are the current needs for the clinics. We will be guiding the hospitals and the clinics throughout the requirements, because as we said, this transitioning, we will try to make it as less complex as possible, so it's not overwhelming for staff members. And yeah, going through the requirements to understand the environment of the clinic, their workflows, is one of the most important things. As soon as the workflows are understood, these requirements are considered. So basically everything is set up. We can then start the implementation based on the clinic needs. And this, I would talk about it in one of my next slides. So I'll give you more details about the implementation, how does it go, and so on. Implementing a system or transitioning from paper to paperless doesn't only mean that a clinic would start from this day documenting everything digitally. We understand that clinics already had records, whether paper or whether in other EMRs, in other softwares, and so on. And we will, of course, offer and make sure that what we call historical imports of patient data is done. So basically, if there are patient data in different EMRs, it can be easily imported into the new digital solution. If it's just paper-based, we're offering options how to scan them in bulk and attach them to your patients once you go ahead, you move forward with the solution. One of the most important, I would say, features and benefits is the integration with the hospital devices. And I saw earlier in Slido that most of the staff members or most of the clinics would need an all-in-one solution that is compatible with all the hospital devices, which is the case. As Abdul Rahman mentioned, by having this digital solution, you would basically centralize all your data and you would have it linked to all the software and all the softwares and all the devices that you have around in your hospital. So basically, starting from the ultrasound devices, time-lapse systems, microscopes, and even external labs. Of course, one of the most challenges, or I would say the fears, is the training and education. We will be literally taking the clinic by the hand, and we will provide a comprehensive training for all the users based on their functions within the clinic, in order for them to understand how this digital solution works. And this would basically allow them to apply the workflows they have to the solution. This is not done. So basically, going paperless would also require support. So once all these steps are done, once the staff members are trained and they know how to use the system, as I previously mentioned, we understand that it is a huge mountain to climb, and that's why we will be still available to support the staff members, to support the clinics within their workflows if they have any questions, and so on. So just to conclude, going paperless would be basically happening from the first contact that we have with the clinic to a solution that is ready to be used in a trained staff, of course, which would come afterwards with supports. Let me grab some water. Sorry. So here, what we suggest as a perfect solution would be MedITEX. MedITEX as a system is user-friendly, no wonder, because it has been developed by IT experts, and of course based on a lot of embryology consultancies and so on, which would make the system basically ready to use when it comes to all the fertility procedures. This would, of course, lead us to comprehensive workflows that are in place, and still the system is flexible in a way that each clinic can apply their workflows to the system. And by comprehensive workflows throughout the system, there are like some guidance, some plausibility messages, information messages, and so on that would guide the users throughout the processes, throughout the procedures that they are documenting for their patients. Again, since we talked about an all-in-one solution, the system is flexible across devices and lab. And as I previously mentioned, we have basically interfaces with all devices, all softwares, and labs too. So in a way, you would have a system. As soon as you have your patients, you can get your ultrasound images coming from the ultrasound devices. You would have your embryo images coming from the time-lapse systems, in addition to the lab orders and lab results. These could be also electronically sent to the labs and then also electronically received. The system is also patient-centric, and it would allow you to document everything about your patient from their first consultation, their first visit to the clinic, until giving birth and until their pregnancy and until birth. One of the most important features, again, is the easy data collection and reporting. As since everything will be now electronically documented, it will be easy for you within one click to just generate statistics, to create reports, use the predefined reports, export them, print this data, and so on, which would then allow, again, the clinics to take data-driven decisions. So that's basically one of the most important features of the system, as it is an all-in-one solution. Of course, while I'm talking, feel free to write in the chat if you have any questions, and then we will go through them later on in our Q&A. So, since we talked about MedITEX as a solution, here I can show you a little bit around of what the system is offering. So as you can see here, for example, on the left side, we have your main screen with your female patient on the left side. So this is a female patient card, her partner's card on the right side, in addition to all the cycles under the overview. So in a glimpse, as soon as you log into the system and you select your patient, after searching for the patient, whether using their name, date of birth, or any search criteria that you need, this is the overview that you would have. And again, in a glimpse, you can have an idea about the latest medical history of the patients, if they have any messages, and most importantly, the cycles. The same on the right side. This is the female medical history, which would basically give you an overview of all the procedures that your patient has been undergoing in the clinic, starting from their consultations, medical histories, medication prescriptions, if there are notes, and so on. And the system would still allow you to create further procedures and to set them as alerts and so on, as you can see on the screen. And of course, this is just done with one click. One of the most important features of MedITEX is the cycle. So basically here on the left side, you can see an overview about a patient cycle. So in this overview, again, with one click, you can see within a cycle all the medication that have been prescribed, all the lab tests that the patient has had during the cycle, and the ultrasound images that are directly being imported from the ultrasound devices. Same on the right side, the culture section is very important and would allow you to document the progress of the oocytes and embryos throughout the cycle. And again, since the system is compatible with other devices, so you can also have images coming from the time-lapse systems and so on. Of course, the two screens that you can see, you can create reports out of them, you can print treatment sheets, and you can even create lists or I would say the culture days and so on. You can have them printed if you want to send them to your patient, if you want to give them to the patient, which we can see afterwards. Talking about reports, talking about treatment sheets and printing. So basically, the system would allow you to create treatment sheets, print them, send them to the patient per email directly from the system. So I imagine for the people using paperwork, right? If you have a treatment sheet, everything is written by hand. I feel like there are a lot of steps in order for you to send it to the patient, if there's a possibility to send it to a patient. So you basically need to scan it, and then you would need to write an email, attach it to an email, and send it to so on. Whereas with MedITEX, as soon as you generate these reports from the system, you would have them in one click, and then you can choose if you want to send them to the patient per email directly. Here, talking about the reports, you can also whether use the predefined type of reports, or we're also offering clinics the possibility to create and customize their own reports with, for example, here, this is our template, but any clinic can create their own template with the header, the clinic logo, the footer, and so on. And like we mentioned in the cycles earlier for the overview and for the culture, even images can be added to these reports. So a patient in the end can have a report of their cycle from the first medication prescription until transfer, for example, with all the ultrasound examinations, the images of the transferred embryos, and so on. The system, of course, offers more possibilities like prescriptions. So it will be possible for you to directly generate prescriptions from the system and again, send them to the patients. Consents can also be created, cryo contracts, invoices, and so on. So all of these possibilities offered by the system when it comes to creating documents to the patient, prescriptions, consents to be signed, and so on, would also include the digital signatures. So we understand that staff members would need to save a lot of time, that it is time consuming to print, sign, scan, send to the patient, and so on. The system would offer you all these possibilities. So basically, each staff member would have his or her signature in the system, protected, of course, and then it would be possible for them to, with one click, to just create this report, which would include their signatures, and then send it to the patients. Other important features are statistics and rates, like we previously mentioned, since everything would be documented in the system, and since the system itself would guide you, for example, throughout a cycle. Let's say you're working on the culture, so the system would count the number of oocytes, what has been used, what has been cryopreserved, and so on, and would give you these plausibility messages, all these information messages to tell you that, okay, I think you're missing one oocyte in here, you didn't document the progress of that oocyte in there, and so on, which means that as soon as you have everything properly and fully documented, it will be easy for you to generate statistics. So for example, here, an example, it's, I would say, a simple example of some statistics that we did run. So we want to see in this clinic how many cycles they had. You can choose a filter, so a date, a time period, and you can also group your results. And then you will end up having statistics like this with the cycle types, the numbers, and so on, in addition to also table representations if you want to double check your data in the system. Of course, all of these things can be printed, can be exported, and so on. Further management features from the system. So we will not stop with the medical records of the patients, their cycles, and so on. The system would also offer you the possibility to manage your clinic appointments. So this is not a simple appointment management where you can just, okay, create an appointment and that's it. So the system would offer features like after creating the appointments, it will be possible for you again. And here we're trying to emphasize that communication with the patient is very important. So the appointments can be sent per email, they can be sent per SMSs, Patients would also get reminders of their appointments. Staff members that are, let's say, a doctor is having a consultation with a patient. This doctor would also receive a reminder that they have an appointment with a certain patient. In addition to that, the system would offer you the possibility to search for free times for you. So what we see in the screen is a simple day with 5 or 6 appointments. But imagine at some point you would have a calendar that is full of appointments, and it would be hard for users, even digitally, to search for appointments. But the system would offer this possibility and would search for the free times for you. And one of the most important features of the appointments management is the waiting times and so on. And that's why we mentioned earlier that we will try by going paperless to enhance the efficiency and to reduce the processing times of patients, because you would end up having waiting rooms in the system and even alerts if a patient has been in the waiting room for a longer time, and so on. So these are basically things that can be set. In addition to the appointments, we're also offering the management of invoices, and based on the procedures that the patient is having within the clinic, it would be possible for you to create invoices, further transactions like refunds, credit notes, and so on. And since we're talking about an all-in-one solution, and since everything is centralized, the system is offering the possibility to have all the billing items automatically triggered. What does it mean? Let's say you have a patient, you had an aspiration with them. I know that now it works in a way that the staff would need to communicate with each other. Okay, this patient had an aspiration and we need to charge this and that and so on. But in this case, the system, since again it's centralized, and I'm trying to emphasize on this, everything will be created automatically. So basically, an embryologist that would perform a transfer, if the clinic is charging for the transfer, the billing item would be automatically created in the accounting system, and then the accountant or the front desk would just need to create this invoice in one click. Of course, you would also see the history of your patients, their invoices, their payments, and so on, and reports can be created out of that. So after talking about all of these points, we noticed after this transition, or after the implementation of MedITEX in all our clinics, that it improves the patient care, the communication with the patients, and also the internal communication, which would come afterwards. Because again, in addition to communicating with the patients, improving their processing times, even internally, the coordination would be improved and would be better, as staff using the system can assign tasks to each other, can assign procedures to each other for certain patients. This, in the end, would enhance the efficiency and the access to information, as again, within within one click, you would have your patient record, starting from their administration details, medical histories, examinations, lab orders, lab results, cycles, and of course, appointments and invoices. All of this is time saving for the clinics, and this would obviously ensure efficient billing and higher revenues for the clinic. And one of the most important features, because now we understand that everything is getting digital. We know that it's tricky for clinics to submit their data to registries. Sometimes I had cases where data was not really accurate as it's being done on paper or Excel sheets and so on. But then MedITEX would come to change that, as it complies with most of the existing registries, which would allow clinics to submit their data securely. Disaster recovery, and that's one of the most important also things, since you have everything digitally recorded. The system would come with with backups and so on, and it would be possible for you to get data in any case. So there's no way that there's no potential loss of paperwork for the patients and so on. Everything would be digital. Everything would be backed up and easily accessible afterwards. All of these points would then improve the hospital operations, provides better service for the patients, provides, ensure, I would say, a better communication internally. And yeah, at least I would say based on my experience with the implementations that we did, I only heard good things about MedITEX itself as a system in the digitization process, which would really make clinics' lives and staff lives and patient care better. Here, I wanted to share with you some numbers from MedITEX. So for now, MedITEX is installed in 450 clinics. It is available in 14 languages across the world, 48 countries, and about 5 million cycles have been documented in the system. So I guess these numbers would tell you a lot about the system itself, and would also tell you about the will of a lot of hospitals, of a lot of clinics to go digital and yeah, to improve their workflows and to improve their processes. Yeah, I hope I was not fast with my part. Thank you for listening. I hope I mentioned all the things that you were expecting and all the things that you needed to hear. And yeah, I think now Sora would just take over.
Yes, thank you, Slim, for the informative space. Thank you, everyone, for your attention. So now we're going to be having an open space for questions, and we're going to be using the same engagement tool. So Slido. Oh, I see we already have some questions. So I'm just going to explain again the concept of Slido. You can enter to this website, slido.com, and then enter the code on the screen, which is 2401224. Or easier, you can just scan the QR code. So take your mobile phones, scan the QR code, and then you can add your questions. If you're facing issues with Slido as a platform, you can also send me messages directly on Zoom, and I will be asking. The cool thing about Slido as well is you can upvote questions that you already had in mind. So if you have any questions, that you can vote up, and then we're going to see them. Okay, so we have, which time-lapse systems do you offer integration with?
I think
yes.
Slim, it's your
Yes,
part.
we basically work with most of the time-lapse systems like EmbryoScope, for example, and so on. So these interfaces are plug and go. They are ready. Yeah. When it comes,
Jouini, I think it's Jouini as well.
yeah, I mean, I can list them in here because I don't really remember them from yeah, the top of my head.
But anyhow, the integration is something much easier these days with the API, with the REST API and so on.
So basically, even if there's, I don't know, a new device in whatever, it will be easy to integrate it because now most of these devices support the same protocols and the same technologies. So it's straightforward. If there's a mobile application for patients, yes, we have an app called Hope, which would track, I think, the patient cycles, their medications, and so on.
So yes, the Hope app can manage the communication with the patient, can drive the patient journey, can notify the patient on his on her activities, daily activities, and it can communicate consent forms, it can get questionnaires from the patient and so on. So yeah, there's a mobile app which is integrated also directly with the EMR, and it can pull data directly from the EMR and send it to the patient.
There's
Yes,
also the online interface, the MedITEX survey, which would basically make it easier for clinics and for staff members, as you would have patients even before coming to the clinic, before the first consultation, they can fill in everything online. So this is called survey. So the patients would fill in their medical histories, vital signs, and so on. So as soon as they're in the clinic, I think it would save time for for the operations.
Okay, and we have some questions in the chat, so I'm going to read some and then we're going to take some from Slido. So we have a question I think this is towards Slim. Is MedITEX compatible and friendly to pre-existing systems, for example, in tertiary hospitals?
Basically, that's what we mentioned earlier, this whole historical imports and so on. We had several imports from other systems, because we're also offering templates to make it easier for the staff members and for the clinics, and then we don't have any issues basically getting data from your old systems to the new one.
Okay, and we have another one is, does the system support French language?
Yes, the system is available in French, and we already have a clinic in further leads in France. Yeah. Also Canada and the French parts of Switzerland. Yeah.
Okay. Cool. So we're gonna take a question from Slido. So can the system manage material stock? I think Slim.
Yes, this is part of the pre-configuration of the system, I would say. So you would have all the material and all the batches configured in the system. They can be scanned using the barcode readers when they're being used, and then the system would just do the counts for you and manage the stocks for you. In addition to that, the system would even give you reminders and information messages if, for example, your stocks are getting low.
Yeah, so like a pre-order levels, and you can set the pre-order level and so on, so you can remember to order stock.
Okay, and Abdul, I think this is for you. So can we communicate through SMS and send reminders for the patients?
Yes.
Yeah, of course. Yes.
Yeah, it goes from their medical records to be sent by SMS and emails to their appointments and so on. So yeah.
Okay, and thank you. From Dr. Raneem, do you have Creo?
Yes, also the system, which is one of the most important features, comes with the cryo storage of the patients. So basically the female and the male cryo storage. And even in order for it to be extremely precise, we're offering the configuration of your cryo storage locations in the system settings, which means if you have, for example, a straw cryopreserved, you can even select your own location that you have in the clinic. So let's say, for example, tank 1, goblet 3, and the colors and so on. So yeah, there's the cryo storage locations are there, and yeah.
So you can manage the location, so you will know how many free spaces you have, and in which location you have this patient, and so on. So it's like a stock management.
Yeah.
Kind of thing.
Yeah.
Okay, and in the chat, because I want to be equal in the question, so we have, do you have interface with HIS to push or pull demographics? I think this is towards, yeah.
Yes, we basically have it everywhere, because we understand that some clinics, they have their own HIS systems and so on, and we don't have any issues with the integration. This is done over H07, for example. We can import patient demographics, export them. We can import lab results, and so on. We can also import appointments. So the system is flexible when it comes to these integrations. Yeah.
Okay, thank you, Slim. We have another question: is any demonstration on embryo genetic testing result?
Yeah, I think feel free. Wasn't it the thing, Abdul? Feel free to just book a demo with Abdul Rahman, and he can show you all these possibilities in the system. So this option is available, of course, and then yeah, you can definitely see it live in the system.
Yes.
Maybe the question here is, yeah, maybe the question here is about the PGD, PGS, the genetic
Yeah.
testing, if it's covered by the system. So
Yeah.
yes, it's covered, or the result can be logged in the system, and it will appear under the cycle of the patient, of course. And there is specific fields for the pre-implantation genetic testing.
Okay, thank you.
But yeah, whenever you want to, anyone wants to have a demonstration on the system, of course you can contact us, and we will arrange that definitely.
Okay, thank you, Abdulrahman. For sure, we can show the MedITEX in a demo. And we have another question: does MedITEX support multiple locations?
Yes, of course. Yes. So you can have a centralized system, and you can have multiple locations in the system, and even the access rights and the privileges can be configured based on the locations. So let's say you want a staff member from location 1 to only see their own patients, staff members from location 2 to only see their own patients, and so on. So yeah, the system supports it, and the access rights can be also configured accordingly.
Okay, thank you, Slim. We have another one saying, I know you can use tasks between staff. Are there any plans for automatic tasks linked to cycle time points? Example, like 48 hours after the blood test to check results?
Not that I'm aware of. The option to create tests between staff is called test manager, that I mentioned earlier, where we can assign staff to each other, link patients, attach documents, and so on. But yeah, it could be done in the future. As I told you, the system is flexible, and we're always open, and we're trying to improve it as much as we can. So it could be that something like this, a feature like this, would come in the future. Yeah.
Okay, thank you, Slim. And I think, Abdulrahman, how long does it take to implement and get the training? This is going to be a shared question. So Abdulrahman and then Slim, you can add to that.
So yeah, implementation can be done very quickly, based on the setup you have in your clinic, the server setup you have. If the server is ready, implementation can take 1 or 2 days. Yeah, the training is also based on the staff availability and the training plan. Normally, we have a training plan based on the modules you have, based on the number of staff you have, and so on. But yeah, for some clinics, we did it. We finished everything in 2 weeks, and some clinics are taking more than that. So yeah, it's on case by case basis. But let's say from 2 to 4 weeks, things can be done.
As Abdulrahman mentioned, basically it would depend on what the clinic wants to have. For example, all the interfaces, historical imports, and so on. And yeah, if everything is ready, it can be done in 2 weeks. It can be done in 4 weeks. It would depend on all these factors in the end. Yeah.
Okay, thank you, Slim and Abdulrahman. I do have another question in the chat, is how can I get training in order to apply it? So I think someone, Abdulrahman, in terms of training, yeah.
So the training is done once the system is installed in the clinic. You will go through a training plan, which will cover different aspects of the business, from the administration, the clinical, and the lab part. So there will be a clear training plan, let's say, which can suit your needs first, and also your capabilities and your staff capabilities. So it will be an easier sale for you to transform from paper to digital. But normally those trainings are customized and based on the need of the location itself, of the clinic itself.
And to add to your point, Abdulrahman, also trainings would cover the settings in the pre-configuration piece, because as we mentioned earlier, so the workflows are different from one clinic to another. So throughout the training, we would also check all the pre-configuration in order for the clinic's workflow to be applied, in order for them to be using it their own way. When I say pre-configuration, as I mentioned earlier, material, cryo storage location, system tables. By system tables, I mean most of the context menus and most of the drop-down menus in the system can also be customized by users, because procedures can be different from one clinic to another, from one country to another. So
yeah, agree.
Thank you. We have another question before moving on to Slido. So someone is asking, can we keep that system internally in our server?
yeah, yes, of course. The system is based on the server client architecture anyway, so it can be installed on a physical server, can be installed on a cloud server. No issues. That's actually the main architecture. Yeah.
Thank you, Stan.
So data of the patient and the privacy of the data is something that we take seriously, and that's why the system normally is installed on your server. Either it's on premise or on cloud that you are providing to us. So we don't have access to your patient data, and except if you give us the access for the support and so on. But yeah.
So basically, the clinic would be hosting the system. We wouldn't host anything. We wouldn't have access to the patient's data and so on.
Okay, thank you. I believe we answered how long it takes to implement. So it's dependent on the clinic. Someone is asking, what about the price range? So, Rahman.
So the price, of course, will vary based on the requirements, based on the modules the clinic will have, based on of course, the number of users and so on. But yeah, once we finish, we can, Dr. Raneem, we can arrange a one-to-one call with yourself to better understand your requirement, and yeah, to give you the right pricing. We are, I think, no one noticed that our prices are high. Normally, our prices are considerably lower than our competitors, let's say. But yeah, the price will depend on the situation you have, on the number of users and the modules you will have, the interface, the integrations, and so on. So we can have a one-to-one call after that and arrange something for you, definitely, to give you an idea about the price range.
Thank you. Okay, and then another question is, what about hardware requirements regarding MedITEX?
That is basically part of the implementation, where we would check the requirements together, and this would depend, because you can basically have the system installed on a computer for one user, and you can also have it installed on a huge server for 200 users. So it would depend in the end on how the clinic would be using the system, the amount of users, and so on. But usually, I would say, these requirements would mainly depend on that, because as I mentioned, you can have a server with low requirements that would support 5 users, and then you would have another server with like extremely high specifications that would support 100 users. And of course, this would then have a lot of impact on the user's experience, how the system would be fast, and so on. So yeah, I think if you're interested, Dr. Noura, also Abdul can send you our standard requirements and so on, so you can have an idea, and then you can have a range to judge from.
Sure. We have standard requirements, hardware requirements, and we can provide it to you. Normally, it matches each server in our market here. So most probably, if you have a server, you will fit the requirement. But yeah, there is a minimum requirement, and we can provide it to you after the session.
Okay, thank you. And then we have Another like anonymous question: what makes MedITEX better than other softwares in the market?
I mean, from where should I start with the list of things? I mean, we're not going to talk about other softwares in the markets, but we're aware of what we're offering. Basically, again, an all-in-one solution compatible with all the devices, all the softwares, all the labs, and so on. Yeah, basically the implementation process, we take it seriously. So we take the clinic by the hand from day one until a ready system with trained staff and so on. Another thing I can, it's a tricky question actually, if you should talk about yourself, good. Another thing I can mention is support. For example, I know it's really important for a lot of clinics to have support in multiple languages, and our support can be done in English, in French, in Arabic, in Portuguese, in Russian, in German, in Italian, and so on. So yeah, these are at least some of the things that I think are important that can make a huge difference. Abdul, if you have something else, maybe.
Yeah, I mean, MedITEX is I think it's the first IVF software already. So the experience we have in developing the software, the number of software installed, the satisfaction of the clients who are having the software, the stability of the software, the updates which is happening to the software on maybe quarterly or 6 months basis. You will have new features always in the software. Yeah, we believe that that the software should support you today, tomorrow, and after 3 years, based on the advancement in the field, based on the requirements, new requirements, and so on. Of course, we have a very strong, as Slim mentioned, we have very strong KPI module, which can generate ready-made reports, which can filter on those reports in different filtration and grouping. So yeah, a lot of things. Of course, the system is on-prem. It is the data of the patient. We don't have access to the data of the patient, so it's not a cloud system. What else? So yeah, a lot of it's installed in different locations here in the region as well. If you are if the one who is asking from the Middle East or North Africa, we have a lot of installation in the region. The support, you can have the support even in Arabic if you'd like to have a support in Arabic. So yeah.
Talking about the system being up to date and always adding new features based on the new procedures and technology and so on, it's also important to mention that it is compatible with the big registries. So, for example, we work with HFEA in the UK, ANZARD in Australia, and New Zealand, ISS in Italy, and so on. So this is also one of the things that I heard, at least from the clinics we're working with. And it's really making their lives easier. Basically, the data submission can be just done within the system. And then, yeah, and imagine having the system basically from patient administration to their cycles, to their ultrasound images, embryo images, invoices, and so on. So it's literally one system that would do everything for you.
All in one solution. Okay,
Yeah.
we have other questions in the chat. So someone is asking, who are the clients in Saudi Arabia and the GCC countries? Abdulrahman.
Okay. So yeah, we have several clients. So let's start from Saudi. We have Dhurriya. We have in the UAE Faqih, Health Plus, the Dubai Health Authority, of course, the DHA. We have in Qatar recently Aman Hospital. We have from Bahrain Al Malki, the American Mission Hospital. We have in Kuwait Medical Harbor, Asif. We have San Joseph in Lebanon.
And in Saudi Arabia,
So
by
yeah,
the way, in Saudi Arabia, because we also started working with Dr. Samir Abbas
yeah,
Hospital.
Samir Abbas
There's
Hospital as
around
well,
like
and
5
clinics,
locations in Saudi
and
Arabia.
clinics. Yeah, yeah.
Yeah.
So yeah, we have a good install base in the region, and this is also giving an idea that we are trying to support we have to support the region anyhow, because we have a lot of installation in the region.
Yes, thank you. Okay, we have 2 other questions in the chat, and then I'm gonna take some from Slido. I think one is like directed to me. So is the webinar recorded? Yes, the webinar is recorded, and we will be sharing it on YouTube. The other question is, does it cover KPIs for our Ministry of Health, MOH? I'm not sure which country, but Abdurrahman, maybe you can cover this.
So the KPIs, we have around 90 ready-made reports, which can be generated directly from the system. And also you can generate create and generate your own reports from the report editor. So whatever is the reporting required, we can say yes. You can, since if the data is there, you can create the report for the data.
Yeah.
So
otherwise, as Abdul mentioned, you can customize your own reports. And of course, because for example, we had the case lately with Serbia, and now they started working with the registries and so on. If it's hard for the users and so on, if the data to be submitted is complex, of course, we also work on that, and we can also create all the necessary SQLs, all the necessary reports for clinics in order for them to be able to submit their data.
Okay, thank you. So let's take some from Slido. How can we book an appointment, Abdurrahman?
So yeah, by the end of the session, I think we will send you an email with the feedback form, and yeah, you will have our contact information. You can contact IT@theta-emia.com, or you can just go to our website and book a demo from the contact us through that. But yeah, by the end of the session, you will have also the email address that you can also communicate directly and book a demo, and we will be more than happy to support you with that.
Yes, thank you. And the other question by Dr. Raneem. So what about ultrasound for assessing ovarian reserve?
Yes, you can whether enter them manually in the system, or you can also have them imported from the devices. No issues. So basically, in addition to that, you can have the images, the follicle measures, and even the videos from the ultrasound devices. We don't have any restrictions when it comes to that.
Okay, thank you, Slim. We have one question, which is data safety and security. Slim?
Yeah, data safety and security. So since the system is hosted by the clinic, that's the first thing. We already now have a version with an encrypted database, so even data in the database would be encrypted. So let's say, God forbid, someone would have access to your database, they wouldn't get anything because all data would be encrypted. Of course, in addition to a lot of measures that we have in the system, like the access rights, locking of sections, and most importantly, the change log. So it would be possible for you to check and to have an overview of all the activities that have been done in the system, starting from patient activities to login activities to search patients, witnessing activities, and so on. So everything is recorded. Yeah.
Thank you, Slim. We have a question in the chat, which is, do you have a mobile app version? Abdurrahman, you can, I think they were not in the call. So.
Yeah, yes, we have an application called Hope. It's already interfaced and integrated with MedITEX, and this is for the communication with the patient, for sending the cycle and the treatment plan, for giving notification to the patient, communicate with the patient, sending forms, education material, reminding the patient about his daily activity. You need to take this medication now. You need to. You are expected to go for, I don't know, ET tomorrow. So be prepared with this and this and that, and so on. So yeah, we can, of course, we can arrange a demonstration as well for the mobile app based on your request, definitely.
Okay, thank you, Abdurrahman. The person who asked about the KPIs, they were referencing to Saudi Arabia. So I believe, yes,
Yeah.
it is covered. Okay, I don't believe we have any other questions. If there's any other question, maybe you can add it to Slido or send it here.
Okay.
I believe.
So as we mentioned, also you can contact us directly for demo, for more information about MedITEX and about the digital transformation in general. If you need any assistance and even thinking about it, not only having a solution, we are here to support you. Yeah, we will be more than happy to have a one-to-one call with all of you. I mean, yeah.
Yes, thank you, Abdurrahman. And we have some comments in the chat. So the same person who asked about the KPIs was saying, I think this makes MedITEX superior on other solutions. Then we have, thank you for the nice comprehensive presentation. I believe MedITEX is the IVF solution of choice. So I wanted to thank everyone for your time. And we have it from Noura. Thank you all. Thank you, everyone. I think there are no more other questions. And yes, let me move on. Thank you. As Abdurrahman mentioned, we will be sending a feedback form tomorrow through emails. Feedback form is for us to better assess how we can deliver like more knowledge that you might be interested in. So in the future, we're planning to have more webinars, hopefully, to talk about other things related to IVF clinics and other things as well. So expect an email from us tomorrow. And yeah, I'm gonna leave the mic over to Abdurrahman and Slim if you have any other things you wanted to mention.
I basically just wanted to thank everyone for attending, for their patience, and for their questions. And I hope I will see you soon.
Yeah, thank you very much, everyone, for attending, for giving us the opportunity and the time to have you. Yeah, we are going to have more webinars with maybe more customized, which can fit more to your exact needs. Looking forward to hear from you in the feedback form, so we can plan better in the future. Yeah, I wish you a good evening, everyone. And yeah, tomorrow is the last day of the week, so in the region here, I mean. So yeah, enjoy it to the maximum and enjoy your weekend.
Thank you, everyone.
Thank you, everyone.
Thank you.